And now, let's move on to rape. So, first one, Republic Act 8353, which is the anti-rape law of 1997. So, let's move on first to the definition of 8353. The These are changes in 1997 expanded the definition of rape and reclassified the crimes as crimes against person instead of a previous crimes against chastity. The amendment also recognized the rape of males both by other males and by females, as well as the both of victims and rapists may either be male and female. Prior to 1997 amendment of RPC of 1930, male victims of rape were not acknowledged under Philippine law. Under Article 266, law defines rape by an act of sexual assault by a person either by inserting his penis into another person's mouth or anal orifice, or inserting any instrument or object into genital or anal orifice of another person. However, rape against male are only considered the law as rape by sexual assault, which carries the lessened penalty of 6 to 12 years. Now, how rape is committed? Rape is committed first by a man who shall have carnal knowledge of a woman under any of the following circumstances. The first one, through force, threat, and intimidation. Second one is by when the offended party is deprived of reason or otherwise unconscious. Letter C, by means of fraudulent machination or grave abuse of authority. And when the offended party is under 12 years of age or is demented, even though none of the circumstances mentioned above be present. Next slide. The number 2. By any person who, under any of the circumstances mentioned in paragraph 1 whereof, shall commit an act of sexual assault by inserting his penis into another person's mouth or anal orifice or any instrument or object into genital or anal orifice of another person. That is why not only female can be a subject to rape or a victim of rape. It may be because of the sexual assault or the new amendment of 8353. Male can be a victim. In legal medicine, the definition of rape is typically defined as oral, anal, or vaginal penetration. It is because of the amendment of RA 8353 of 1997 that involves threat or force against a person who is unwilling or incapacitated. Such penetration, whether wanted or not, is considered statutory rape if victims are younger than the age of consent. Rape is an expression of aggression, anger, or need for power. Psychologically, it is more violent than sexual. Non-genital or genital injury occurs in about 50% of rapes of female. The next one is sexual assault is rape or another part of the rape or any other sexual contact that results from coercion, including seduction of a child through offers of affection or bribes. It does also include being touched, grabbed, kissed, or shown genitals. This is the sexual assault. Females are raped and sexually assaulted more often than males, which is true. Most likely here in the Philippines, the most cases of rape is between the male and the female, and the victim is female. Males who are raped are more likely than females to be physically injured, to be unwilling to report the crime, and to have multiple assailants. So, now, let's talk about the result of rape. The rape may result in the following. First one, the extragenital injury. The extragenital injury, it is the injury found outside of genital organ of a female. Outside the genital organ of a female, not inside. That is extragenital injury. The genital injury, it is an injury of male and female sex organs, mainly those outside the body. It is also refers to injury in the area between legs called the perineum. So the part between the legs of the male and the female may cause to perineum. That is genital injury. The next one is psychological symptoms or somewhat what we call the rape trauma syndrome. It is psychological trauma experienced by a rape victim that includes disruption of normal physical, emotional, cognitive, and interpersonal behavior. Next one is sexual transmitted disease or STD. Given example is syphilis, gonorrhea, chlamydial infection, and trichomoniasis. Sexual transmitted disease refers to a condition uh, passed from one person to another through sexual contact. You may contact an STD by having unprotected vaginal, anal, or oral sex with someone who has STD. The next one is hepatitis. Now, hepatitis is an inflammatory condition of the liver. It is commonly caused by a viral infection. The next one is the HIV infection. It is the virus that attacks cells that helps of the body fight infection, making a person more vulnerable to the infection and disease. It is spread by contact with certain bodily fluids of a person with HIV. In HIV, it must be having a sexual interaction with a person with HIV. The difference in STD is that STD, you can get STD by mere on the anal or on the mouth or on the vagina of a person having a sexually transmitted diseases. The next one is bacterial vaginosis. The bacterial vaginosis, it is the vaginal inflammation caused by overgrowth of bacteria naturally found in the vagina which upset the natural balance. So, the last one, rape may result is that pregnancy. We know that if you're having a sexual interaction between a male and a female, and the sperm cell and the egg cell will unite, pregnancy will occur. So this the some picture of a perineum or genital injury. As you can see, the triangulation or the diamond here at the up part here at the up part of the presentation or the picture is from the genitals of a female, and this part having a perineum in the female. In the male, this part having a perineum between the legs of a person. So next slide is the sexual transmitted infection or the STD. So in the study, the statistics get more than 1 in 6 have sexual transmitted infection. So this is the example of STD. This infection or this kind of wound or infection found in the genital proper or in the penis or the vagina of a person who has STD. So the next one, it is the bacterial vaginosis. This is the bacteria found in the vagina. So the next one is the intervention to the rape victims. We know that if a person is raped, they are severely suffering from a mental or physical abuses. They are suffering from emotional. That is why there is there is a intervention program that is given to the rape victims. So what are those? First one is the counseling. It is the counseling, giving advice by a psychometrician, giving a program to a rape victim to forget what what she've done at the past, giving more uh, giving more advices, and also the psychological treatment. So psychological treatment is the treatment on the emotional part or the emotion of the rape victim because they are suffering from trauma. Of course, from the trauma from the rape. They are wounded. They are wounded inside and out. Also their brain is having a trauma. That is why they need some psychological treatment. So that's all. Thank you for listening.